read out your Bible, you can fall down on your knees and pray.
And the Alabama chapter of the American Academy of Pediatrics actually recently sent out a survey to pediatricians to ask them how would the shortcomings in the Medicaid budget affect their practice. And 50% of the responding pediatricians said that if Medicaid wasn't fully funded, they would have to stop taking Medicaid in their practice. 50% of the responding pediatricians also said that they would have to lay off staff. And if Medicaid has to cut physicians' payments at the highest level that would be expected, 1 out of 6 pediatricians would actually consider retiring or moving out of state. And that is a huge deal, because even if you have Blue Cross Blue Shield, if there is not a pediatrician in your area, that will take you through.
If I didn't have Medicaid, I don't know what I would do. Medicaid has covered his hospital bills, his basic immunizations, his colds, his earaches that we've sat up through many nights suffering through. As a single mother, I couldn't afford any of those treatments.
What's the process like moving forward? Are these cuts a done deal? How do you reverse it? What's next?
Medicaid has identified sort of the short list of cuts. Of course, everybody is doing everything they can to prevent or stall implementation of those cuts. It's important that we understand what is on the chopping block, because that's the reality check that wakes people up to the importance of this decision. But nobody wants to go to the next step of actually flipping the switch on those services. So we have seen the list of services that would be the first to go. Some of them are very specific services like adult eyeglasses and outpatient dialysis. Some are broader, and that would be the cuts to provider payment rates, which would be a little slower to show the negative impact, because initially doctors and other providers might adjust to that change, but we think that in fairly short order that would have a really negative systemic effect, as physician practices in particular figured out that they just couldn't make it, just couldn't continue to operate on that margin.
Are you just trying to work on the state end right now, fixing their Medicare? What happened to the billions in federal money that we could have gone after and gotten down here to take care of this problem?
This problem that we're addressing today is the budget question for the 2017 Medicaid budget. The fact is we have an inadequate budget that has been passed and approved over the governor's veto. So it's the budget we have to consider the real budget.
Okay.
It's not adequate. It would have a direct impact on the families that you're looking at and the overall healthcare system.
So is anybody still working to try to get the federal dollars?
The question of accepting the federal funding for Medicaid expansion is a separate question, but some of us, and I'm one, believe that it could be part of the bigger solution. That's something we need to have on the table as we talk about how to stabilize this Medicaid program.
Efficient that we do draw down a lot of federal dollars compared to our state dollars, but then it will also ask questions of why do we have certain limitations by CMS on limiting enrollees, on checking on net worth, on looking at certain caregivers, looking at the disabled, and some of the requirements like the SSI disability that we all read and have seen, and y'all may have done stories on, that sometimes tends to be too liberal and maybe not discerning enough on whether somebody's really eligible or not. All of those people, there are needy people out there that really need to be helped, and those that need help. But we've got to, I think all of us need to look at, including CMS, of making sure that the people that are receiving the services really do need the services, because there's enough need out there, and right now there's not enough money to be able to cover those.
But it wouldn't be a crisis for you if the state had accepted the federal billions of dollars.
No, that's not true. That would have at best been a short term. The problem is, as you've seen, the enrollment goes up. She made the case that the cost per enrollee has come down. That could be made because as you have more enrollees, maybe some of those enrollees aren't as costly. The challenge you find with the expansion of Medicaid is that the estimates in Alabama were that it would go up 300,000. The states that have expanded, in some cases those estimates were way low. When you cover more people, you're not going to save money. The federal government covers those initial costs, but the reality is the federal government's running trillion-dollar deficits. So I think that most of us in government understand that we do have a responsibility not only to look after state dollars, but also to try to help our friends in Congress better manage the taxpayer dollars of our constituents at the same time.
Or play politics.
No, I would say, no, you're not playing politics. We're governing. Governing has costs. Well, you know what? We all die sometime. You know, we're all mortal.
Because of government policy.
No, we all have a finite period of time on this earth. I think sometimes that we confuse saving lives with extending lives. I think one of the most important things that showed up on that chart is that the young children, you know, the children that pass, and that we're spending like 41% of the money on children in the first year of life. We're spending a lot of money on the elderly at the end of life. I think as a society we need to debate and look at all of these things, because ultimately we're going to have to look at, if you're not, you're going to get into rationing. We all have to look at quality of life. We all have to look at the way we spend money and the cost of that money. And the first step, like I said, is understanding where those costs are. And we all have to come to grips with our mortality. It's just a fact of life.
But the Alabama legislature doesn't have anything to say about what happens with the federal government.
Well, no, but they're not in a direct vote. But ultimately, the legislatures, the states, or the federalism, the states have a big role to play. Medicaid's a voluntary program. But at the end of the day, yes, there's lots of federal requirements. There's some of which are somewhat reasonable, I think, would help us better manage the money we have and give better care to people that truly need it versus some that may not be as needy. But it's all a matter of choice. This all has to be a debate. It's time for us to have real debates on real issues. They're not going away. They're reaching critical mass. You look at the debate at the federal level, or the lack thereof, and ultimately we have to govern. You know, elections have become perpetual. 365.
Should you take the federal money or not?
I think you can take some of it, but you can't take, the challenge with taking federal money is that in some cases, the federal requirements for the additional money cost you more than the money you get. If you come here to the contract review meetings that are held in this room, and you start to look at all the contracts that are required by those rules that get promulgated by those people in Washington, sometimes taking the federal money and cost you more than the benefits you receive from it.
Doesn't it provide jobs and thus more income and more tax revenue?
But jobs compared to what? Compared to private sector jobs? Compared to productive jobs? You can always try to make a case.
Hospitals, not private
Doctors,
sector?
physicians.
Well, again,
who want to threaten to leave the state right now.
We have a debate. Listen, the point is that there's so much gaming going on in healthcare. Because we have created a real messed up system, and somebody needs to peel back, you know, the onion. And I think this will start that to some degree, to the extent that y'all are able to help and people are willing to pay attention. Football season's not going on. It's almost summer. This hopefully will have another month or two of people focused on issues. Certainly these changes have to be made at the federal level. Congress needs to look at these things. The president, you know, the executive branch, they need to look at these things. We have a big election coming up, and I would argue that the questions that we have to answer in this election, that health care is the biggest one. It is the biggest challenge we faced. And the attempts have been made, and I at least give the Democrats credit. They're reaching out and trying to do things. Mr. Sanders has plans of what he wants to do. And we have to look at what these costs are, you know, and what's sustainable. He said 80% of the costs are for elderly and for people in this state in the last few months of their lives and in people with chronic illnesses. The reality is that we've got to have some discussions about quality of life, about the expenditure of money, and about the cost. You know, in this country, the transfer of wealth from working to non-working, for every dollar that you transfer from working to non-working, you're transferring $7 from young people to old people. That's a moral debate, and that's stuff that people need to start talking about. Pay for it.
So just to clarify, barring manna from heaven, do you expect to see any more funding for Medicaid?
I do not right now. I think Senator Marsh said it. He said at some point these impacts have to be felt. We've had demagoguery in a lot of cases, and it may be reality in years past. Back when Senator Governor Riley, tried his tax increase. And I remember one of the senators from my district at the time talking about people being kicked out of jails, and Meemaw was going to come home from the nursing home to live with you. I mean, there were all these things that people talked about. The bill failed by 2/3. A lot of those things never came to pass. Cuts were made. So I think that there just has to be some realism, and I think that some of these cuts will be made, and those impacts will have to be felt, and then people will react to those to what ultimately happens.
If the governor and the legislature had taken the federal money, $1 billion a year, we wouldn't necessarily be talking about this crisis today.
You're talking to the choir. That's absolutely correct.
Okay. They said it's not correct, that we would still have this technical budget issue.
We may, what they are concerned about is that after that period of time where we have to pick up so much, if we had taken that money when it first came out, getting the RCOs off the ground and everything, we could have already had that taken care of. And if they wanted to opt out, you know, after you feel that you've gotten it out, because this is supposed to replace it, then we would have been well on our feet to be able to do that. But right now, we just cut our noses up and spite our face. All the other states have taken that money. They've taken our money because part of that money was ours when we didn't take it. And so right now, we've sort of backed ourselves into a corner. To me, that is very short-sighted, that you would hurt the people not to take this.
Pray to the Lord, but mama, but it ain't gonna do no good. You're gonna need my help someday.